balance method can sort it out. It can be just a neuropathic pain. My husband played volleyball for former Soviet Union junior team, and his column was very damaged because volleyball players, they jump all the time. And there was few acupuncture sessions. He has no pain. His back hurt for many years. So we can sort it out very quickly, especially with the balance method. So, if one wants to practice successfully, one needs to choose the method that is not famous or not nice, but the one that effective clinically, the one that brings you results, so the patient can trust you. And balance method is the one. Those people who learned balance method and started practicing it, they all move their practices to the balance method because they see the results. That's why we are here. So today we will go to the roots of the balance method. And the roots of the balance method is eating. And we will talk with you about bhagwas as well. But before doing this, let's remember about Zhang Fu diagnosis and 8 principles. Do we use it in balance method? Yes, we do. But when we go to the internal disorders, when we treat local pain or local disorder, it can be swelling, it can be tingling, it can be burning, anything. We don't need to remember about Zhang Fu or 8 principles. Just forget about it for now. We are doing channel acupuncture. I will give you a bit of the history of the channel acupuncture. In old China, there were acupuncturists, herbologists, and healers, as in any other country. So when something happens, person usually goes to the shaman or healer. If it doesn't work, he tries acupuncture or herbs. In old China, herbal medicine was always elite. It was on the top. When communists came to China, they decided that acupuncture is kind of the old type of medicine, or prejudice. It's just prejudice. And they decided to eliminate acupuncture. So half of acupuncturists were killed, another half just flew to other countries, and those who are left, they couldn't practice. But acupuncture was always family tradition in China. So it passed from granddad to the father and so on. So when Mao came, he decided that acupuncture actually is a pride of China. So we must recover this ancient skill. But who was going to teach acupuncture? There were no teachers left. So herbologists started treating acupuncture. That's why they brought the Zhang Fu diagnosis, 8 principles, and the other diagnostic tools into the acupuncture school. Acupuncture was always channel acupuncture, and it was based on relationships between channels. This is what we are going to learn. And now let's think about reflective zones. When we do tongue diagnosis, what we look at the tongue? We look for organs. The distribution of the organs, the tip of the tongue related to upper jaw, middle of the tongue, middle jaw, and the root of the tongue to the lower jaw, right? And then we can guess about the condition of the organs. When we study the auricular acupuncture, Nozier brought the principle of auricular acupuncture into our schools. So what we look in the ear, we look the relationships between certain parts on the ear and the body. Sujok, what we do? We project our body into the hand, into the palm, and see for relationships. For high blood pressure, we usually bleed tips of the fingers. Why? Because they coincide with the position of the head due to 20, because too much tension. So our body sees the relationship between the reflective zone and the real place where the problem is. So, for example, if someone has a problem in the, let's say, in the middle of the chest, it will be reflected in the middle of the arm. It will be reflected on the ear. We can find the same place in acupuncture. We can find the same place on reflexology charts. In Germany, there is a doctor. His name is Peter Mandel. He does color puncture. And he is quite a rich man. He practices color puncture since 1970. And his famous therapy is called prenatals. What he does, he projects the spine onto metatarsal bone and treat metatarsal bone, and the spine becomes better. So in our body there are so many projections. And what happens? Let's speak about ear acupuncture. When we see the painful spot, when we palpate and fix the painful spot on the ear and we needle this place, somehow the problem in the body which is related to this place sorted. So again, there is a connection between the reflective point or reflective zone and the real zone where the pain is. So in balance method, we look for relationships between body and limbs. Why it's so convenient? When you practice auricular, you have to be so precise. You have to be so precise, because if you're 1 millimeter left or right, you are not on the liver, but you're in the stomach. So you must learn it well. In balance method, you have the whole limb. So you can be absolutely free to look for Ashi points. But what are the Ashi points? In traditional Chinese acupuncture, I learned in the school that Ashi points is if someone has pain, so I have to palpate around the pain, and then there will be Ashi points. It is translated ouch. But in balance method, Ashi points is the tender points on the place which is related to the painful one. So it will be on the limb only and never in the painful area. And in the balance method, we never needle the painful area. And now, guys, we are going to have a journey into a very, very deep subject. And this is called Bagua.